Okay, welcome everyone to the Special Populations Core 2025 seminar series of the New Jersey Alliance for Clinical and Translational Science. Before we jump in, today's webinar episode will be a new format from our traditional talks. Today, we're excited to have a panel style format for the webinar. As always, please feel free to ask questions along the way, and we will also be sure to reserve some time at the end of the talk dedicated to Q&A. You're also welcome to put questions or comments in the chat as well. It's my pleasure to introduce our speaker today, Amy Fischer. Amy Fischer is the program director at Rutgers Project ECHO within Robert Wood Johnson Medical School Office of Community Health, where she oversees the strategic growth and implementation of statewide telementoring programs that expand access to care and advanced health equity. With more than a decade of experience in healthcare leadership, Amy brings deep expertise in program development, stakeholder engagement, and operational excellence. She holds a bachelor's degree in business management from Rutgers University and a master's in healthcare administration from Seton Hall University. We're very excited to have Amy with us today, and we're so looking forward to this presentation. Amy and a panel of experts will discuss how Rutgers Project ECHO use virtual case-based learning to support frontline professionals and expand access to care for New Jersey special populations. This session will highlight how Project ECHO promotes equity, disseminates research, and drives impact through education, featuring real-world insights from hub team members working across areas like maternal health, substance use, and chronic disease. So, Amy, over to you. And I will stop sharing my screen.
Thank you, Hannah, for that introduction, and thank you, everybody, for joining us today. As Hannah mentioned before, we want this to be interactive. Please feel free to drop questions in the chat, raise your hand, and join the conversation. For those that are here today, we welcome you to introduce yourself in the chat. Let us know who you are, where you're tuning in from, what department in Rutgers or beyond. We'd love to meet you today. So with that, I will get started. I just wanted to, on behalf of our team, thank the NJ Acts team for the opportunity to share about our program and our work today. ECHO, or Extension for Community Healthcare Outcomes, aligns closely with NJ Act's goal to integrate community engagement, social determinants of health, and population health data into research. And at its heart, ECHO is about equity. We aim to amplify community voices, empower frontline professionals, and make sure that research findings reach the people and communities that need them the most. So with that, we will go on to today's objectives. So we are hoping to show you all how Project ECHO functions as both an educational and a dissemination platform, advancing equity, professional development, and community engagement. I'll share a brief history of the ECHO model and our footprint here at Rutgers. And then finally, the most exciting part of the day will be our panel discussion, and you'll be able to hear firsthand about how ECHO's impact and real-world application in some of different professional spaces. Before we jump into that, in the spirit of ECHO, we want to hear from you all. Just kind of get a pulse in the room of how familiar you are with Rutgers Project ECHO. Have you heard about us? Are you slightly familiar, a little bit, very familiar, or have you participated in a session or worked directly with us before? We'd love to hear from you. We'll give it about, I don't know, a few more seconds. Already at 70%, so that's great. Thank you all for your engagement. All right, so it looks like we have a balance on both sides of the spectrum. It could be a little bit skewed because I know we have some team members here that definitely have participated in ECHO. But I think that's perfect because ECHO itself, we thrive on diverse perspectives. Those that are new bring fresh curiosity, and those that are familiar help add to the depth of the discussion in our ECHO programs. So with that in mind, let's move forward. So let me just take a moment and ground us in who we are and what we do at Rutgers Project Echo. So at its core, Project Echo is a global educational initiative that originated out of the University of New Mexico. It's designed to build learning communities where providers can share expertise and solve patient care challenges together. Our vision is simple, but powerful. We aim to create collaborative communities that tackle health disparities and improve public health in underserved areas. Rutgers Echo was launched in 2016 at the Robert Wood Johnson Medical School. And today our programs reach all 21 counties in New Jersey, and we extend into states across the country. We run ECHO programs across a wide range of focus areas, from perinatal health and substance use disorder to mental health, diabetes, infection prevention, health equity, community health worker training, and care for adults with intellectual and developmental disabilities. There are more than that list, but just know the model is very adaptable to virtually any public health priority. And importantly, one key factor is that we are fully grant funded. So that support allows us to keep the sessions free to our participants. That's something that we're proud of, but it also means it's a challenge for us, and our future depends on continued funding. And without it, our work would not be able to continue. On the right side of the slide, we have a link, and if Hannah and team are able to share the slides out to those after today, you'll be able to look at that in more depth. But just to summarize some of the reach that we had last year in 2024, we reached over 1,500 unique participants, delivering over 133 individual ECHO sessions, over 9 different ECHO programs, over 750 different organizations. And then this 37 case presentations represents individual frontline providers who brought a scenario to the ECHO conversation, asking for some recommendations and support to help navigate some challenging patient situations in their practice. So these numbers overall don't just represent the activity that we do at ECHO every day, but they represent providers that are now empowered with new skills, organizations that have built stronger networks, and communities that are now receiving better care. So with that foundation, let's look a little bit more closely at what makes ECHO unique and how that can translate into practice. So ECHO is not a one-time training. It's longitudinal, it's scalable, it's a virtual learning model. We democratize access so that primary care providers can gain specialist level tools and expertise. And it naturally builds in professional development, and it has a strong peer-reviewed evidence base proving its impact. Our aim is to level the playing field and bring knowledge where it's needed most. So each individual session is led by an interdisciplinary team of subject matter experts, which will be modeled by our team representing the panel later in our session. They help facilitate the education, lead the discussion and interaction throughout the sessions. And each ECHO session usually lasts for about an hour and follows a simple structure. It kicks off with a short expert-led presentation. We usually have a case presentation that follows, peer discussion, and the hub will make recommendations and invite others on the call to weigh in as well. And then we usually try to provide practical tools and resources that participants can implement in their practice immediately following the session. Our goal is to create that interactive learning loop, so where everyone learns from each other, not just from the expert. And that leads to the power of the ECHO model: all teach, all learn. So one key thing, why does ECHO work for special populations? Why we're here today sharing this information. At ECHO, we focus intentionally on populations that are often underserved or face unique barriers. Like we said before, those with diabetes and chronic kidney disease, older adults, people with intellectual and developmental disabilities, issues with access to maternal and reproductive health, those that have issues navigating language access or cultural barriers. ECHO works in these spaces because we address those barriers directly. So we always come with an equity-focused problem-solving lens. We build trust through culturally responsive and trauma-informed learning. And we always pride ourselves on amplifying the voices of our participants that help shape the session content, which leads to learning timely and immediately applicable strategies for their practice. ECHO is designed to target the underserved, those groups that are often overlooked by traditional training or systems, including racial and ethnic minorities, people with limited English proficiency, or providers working in resource-limited settings. ECHO can serve as a platform for research and dissemination. It offers a scalable, rapid way to spread evidence-based practices and research findings to frontline providers. That real-time engagement helps boost implementation, but also strengthens the workforce, helping those that participate feel supported, connected, and better equipped to serve their communities. One innovative thing that we've been doing of late, we've been hosting community chat sessions as another way to connect directly with the community. So these conversations invite patients, families, and community-based organizations to join providers in dialogue. They've been especially powerful in elevating lived experience and patient voices, while also building stronger connections across different sectors of care. And Les, who's here with us today, but we've also partnered with his team over at the Ernest Mario School of Pharmacy to integrate simulation-based sessions into our work. These sessions use standardized patients and trained actors, which allows providers to actually practice what they're learning in ECHO. So it's a chance to see both the good and the bad scenarios play out, making those lessons more tangible and showing how best practices can be applied in real life. And additionally, we've offered more accessibility opportunities in the spirit of ECHO to our participants in some of our programs, especially our community health worker program, where we're offering simultaneous interpretation and translation services in Spanish live during the sessions. So when we say ECHO works for special populations, we mean it's not only closing those knowledge gaps, but it's closing equity gaps, it's amplifying voices, and we're accelerating that spread of innovation where it's needed most. One other bit about ECHO, this slide really shows kind of the sweet spot where ECHO connects with population health and research dissemination. So we're expanding access to specialty care. We're bridging that gap by empowering those frontline providers in underserved areas with specialist knowledge that normally would only be available maybe at academic medical centers. We're providing training for providers to help build their self-efficacy, their confidence through those case-based learning conversations. They're gaining that capacity to manage complex issues right in their own communities rather than needing to refer everything out. We're looking at preventative health measures. So we're not just treating conditions after they emerge. We're aligning with population health by supporting prevention, chronic disease management, and reducing disparities. So by equipping providers with that evidence-based practice model, we're helping to identify and intervene earlier. ECHO has always been data-driven. We're not just delivering that education and walking away. We want to track, our participant knowledge gain, their skills, their intent to change their practice. And this data allows us to continuously refine our programs so what we deliver is relevant, practical and measurable. And then overall, it's a collaborative learning network. We create a community of practice where providers share best practices and innovative approaches. This network, becomes a ripple effect, as you saw on the previous slide, kind of that circle graph, spreading effective interventions, fostering that bi-directional exchange between frontline providers, researchers, the community, so that this information isn't just sitting in journals, but it's being mobilized into the community. So, in summary, the biggest thing I can say is that we don't just educate. Our aim is to really build that capacity, spread the innovation, and accelerate that equity-focused health improvements across all populations. So with that, I'm happy to take any questions, anyone needs any clarification, but then I'd like to turn it over to our panel. During this discussion, you'll hear, directly from hub members about how this model has shaped their work, deepened community engagement, and helped advance equity in real-world settings. And I encourage you, as you're listening to that conversation and hopefully chiming in as well, to think about how ECHO differs from other traditional training formats, how it centers community voices, and how it might serve as a tool in your own work. So yeah, with that, Sean, I'm going to put you in the spotlight unless there's any other questions that have popped up in the chat.
Great. I haven't seen any questions in the chat, but feel free, as always, to enter any questions into the chat about Echo and anything that comes up during our panel discussion today. Hi, I'm Sean Cudahy. I'm a program support specialist at Rutgers Project Echo. I'll be facilitating this panel. We are joined by some of our favorite hub team members on our Rutgers Project Echo series. We have Les Barta, Dr. Clement Chen, Lisa Lawson, and Jay Mason. I'll allow them to introduce themselves in a little bit more detail, and I'll pull down these screens so we can all see each other. So Les, if you could first start by introducing yourself and how you got involved with Echo.
Sure. Thank you. And thank you for having us today. My name is Les Barra. I'm the director for the Simulation Technology program here at the Ernest Mara School of Pharmacy as part of Rutgers University in Piscataway. I have actually not gone to pharmacy school. I'm a paramedic by trade for the past 25 years. I did an undergrad here at Rutgers, started here, and I'm currently working on my doctoral dissertation here at Rutgers again. So for the forever student that's been involved in a couple different places, but really where I am is in the simulation world. So I've been a simulationist for about 20 years, and that basically is creating that immersive learning environment for our learners to come together and learn how to become healthcare providers and or to find those safety threats and errors that happen in medicine. Part of the Project Echo sort of opening where I found it was actually during COVID, when we first started getting some information and learning things as the pandemic was coming through. I was here at Rutgers at the School of Pharmacy for the past 2 or 3 years at the time as we got into the pandemic. And the Echo sessions that were actually put together at the national level gave us really good insight into sort of what was going on and some of the information that was being disseminated from the large metropolitan centers and other parts of Europe as we were seeing the COVID pandemic come through. Once I found out about Echo, I had joined some of the Rutgers Echoes here, knowing that the brand was there. I had joined the substance use disorder one, I joined the chronic pain one, and then ultimately started getting involved into presenting some cases and then having a discussion and presenting as part of the hub teams for it. So thank you. Welcome. Thank you for having me.
Thanks so much. And then we'll move on. Dr. Chen, if you'd like to introduce yourself and how you got involved with Echo.
Sure. Thank you so much, Sean, and for everyone's attention. I'm a clinical pharmacist specialist and academic detailer at the Rutgers, New Jersey Medical School for the Northern New Jersey Medications for Addiction Treatment Center of Excellence. I also agree with Les. It's very important to be a forever student, and being in this Project Echo really helped support being that forever student because I'm also at Johns Hopkins trying to obtain a master's of public health, and I'm a fellow there in addiction. So really appreciate the opportunity to really continue learning, and that's what Project Echo is about. So the Northern New Jersey Amity Center of Excellence is just for those who may be unaware, is a program established by New Jersey Medicaid to help office-based practitioners, whether you're a cardiologist, a general practitioner, infectious disease specialist, integrate addiction medicine as part of their care. And as long as you're designated an office-based addiction treatment provider, or OBAP for short, you would also have a patient navigator to help with the non-medical needs. You're able to receive enhanced reimbursements for providing addiction care to your patients. So it's really about increasing access and really about improving equitability, I hope that's the word, to patients who use drugs and really improving outcomes and reducing overdose deaths across the state. So as an academic detailer, my role is to provide that evidence-based education to clinicians with the goal of improving patient care, helping providers make sense of the literature and apply it in real-world settings, meeting with providers and supporting clinical decision-making, and also understanding the barriers because as Amy's presented in one of her slides, implementation is very important. We know the literature exists that medications for opioid use disorders is effective, but why is it not utilized on a broader scale, right? So a lot of the implementation challenges. So we want to bridge any potential gaps in knowledge in the available literature, educating the providers on the research so they can apply it to their practices. And so I learned of Echo because one of our deliverables is to conduct bi-monthly learning collaboratives on key topics in substance use disorders. we were just starting, just prior to COVID, and we were a newer program at the time, and we needed to outreach as many New Jersey providers as possible. So I was introduced to Rutgers Project Echo by our chair of the department, Dr. Petros Lavonis, who mentioned that we can collaborate with the program. And both the ECHO program and our learning collaborators really fulfill that same goal of building learning communities and really improving outcomes in all areas across the state, reducing disparities, improving care in underserved areas. And I wanted to add to what Amy stated, the ECHO program expanded to other states, but I know in some of these ECHO sessions, we've expanded internationally as well, someone from the UK. So I wanted to point that out. So I've since been part of the program for nearly 6 years and really appreciate the continued collaboration.
Thank you so much. Lisa, it would be great to hear from you and how you got involved with ECHO.
Sure. Good afternoon. I am Lisa Lawson. I serve as the Executive Director at New Jersey Clinical Consulting. I'm also the Executive Director for Forge Health here in New Jersey. I have had the privilege of serving as a series leader for multiple ECHO series over the years, including for COVID, the substance use disorder series recently. Shout out to all of you who are on that today, the maternal child health opioid use disorder series, and the CARES Community Health Worker series. I've always appreciated how ECHO it's just so different than the traditional learning or webinar-based series that you might attend. Joining initially, I was actually accidentally invited to join the epidemiology series. My email is very similar to someone else's email that I used to work with, so I'm happy. It was a happy accident. I quickly learned that it's not just a lecture series, right? It's everything that Dr. Chen and everyone has said so far. It's really a community of learning where all of our expertise can flow in all directions, and it's just an incredible space for medical providers, social workers, frontline providers, community health workers, folks in the community. We can all come together and share these insights and grow and learn from our challenges in such a meaningful way. And just to kind of mirror what Amy has shared, this is more than education. This is us in real time increasing equitability, increasing access to care, empowering our local leaders and our local providers and our healthcare legislators in the community to improve care where we work, where we live. And again, I'm just honored to share this experience with all of you.
Thanks so much, Lisa. And last but certainly not least, Jay, if you wouldn't mind introducing yourself and your involvement with ECHO.
Sure. Hey, everybody. My name is Jay Mason. I'm the Director of Community Programs in Project ECHO at the West Virginia Clinical and Translational Science Institute, CTSI for short. I got hooked up with ECHO in May of 2016. That's when we launched in West Virginia. And our story is a little bit different in that the call to start ECHO was actually from a primary care facility in West Virginia. They were having with treating hepatitis C patients and even screening them. And so they were looking for ways to beef up their education and mentoring, and they came across Project ECHO. And we had worked with them before as the CTSI in community projects, and they actually came to us and said, do you think you could do this for us? We don't have the manpower, but could you run these series? And so we did the training, and kind of the rest is history. We've been have completed, I think, 15 different projects in West Virginia. We're also a super hub, which means we train other sites to do ECHO. And that's how actually we got connected with the Rutgers group is through our Hub Sustainability series we put on as a super hub with the Chicago ECHO team, talking about things like funding and finding champions and things like that. And so everything that everybody has said is so true about ECHO. It's a great model. It's more than just educating people. It's creating that learning collaborative and really gaining that access. I mean, if you can do it in West Virginia, where access is difficult, to say the least, it can be done at a high level everywhere else. So thank you. Appreciate the opportunity.
Yeah, thank you. Thank you, everyone, for starting us off and really kind of kicking off our conversation. One of the common themes we heard from all of your introductions is how Project ECHO is really different from a lot of other traditional online learning platforms and even live learning. So I was wondering if maybe I can have Les kind of kick us off on a conversation about really what makes Project Echo different from those other learning platforms, and even maybe including some of your experience running the simulation lab sessions?
Sure. So thanks. And I reflect back to sort of when I first joined the first Echo, I think it was one of the substance use disorder ones. It was the same type of thing, an accidental sort of email. Like I was like, oh, this is going on. I've got nothing to do. Let me see what it is. I happened into it. And once you sort of you listen to the didactic, and then all of a sudden these experts are literally available to you and to ask questions and to really kind of come together and sort of crowdsource information, but in a positive way, because you know it's coming from the experts that are in the hub, and they can help vet that and also connect resources for those in the community. When we started talking about some of the projects that we could do, I think the first time Amy had reached out for one of the hubs was we were talking about CDC and Project First Line, which was really tied to personal protective equipment, reducing the rates of infection after the pandemic had continued, and we were sort of seeing an uptick in the frontline providers really being exposed to things. And I'd proposed to them, like, we should be able to do a simulation based for this, and maybe we can show them and demonstrate to them some of the best practices that our Echo Hub had developed. And sort of that had grown into it and became an organic way of growing subject matter expertise, but then also simulating it and showing and demonstrating it to the learners who come in. So rather than a traditional didactic lecture, boring slides, we put the learners into that simulation or the immersive learning environment as much as possible and let them experience it. And then they begin to have sort of that reflective moment, and that aha light bulb goes on, similar to how I had it with the SUD when I first started within COVID.
Great. I'd invite everyone else on the panel. Do you have any thoughts on how Echo is really different from those other models?
Yeah, sure, Sean. I'll just briefly add that it's really that two-way approach between the hubs who are the experts, but I also think of the network as experts too, because they bring forward what's happening on the boots, on the grounds level, and then forming the hub team in, let's say, the academic centers, what is really happening, so we can kind of integrate or kind of revise some of the suggestions and recommendations that will best fit what is needed in the community. So we have research or literature that says one thing, but if providers are unable to implement it because of some of the challenges they see, for example, the age of fentanyl, now we have xylazine, and now really medetomidine, and how do you best approach patients who are, injecting drugs and, suffering from cardiovascular complications, and wounds and things like that, and how do they best address it? So it's like really a two-way street, and that's why it's all teach, all learn.
Oh, let's go for it.
Clement, you bring up actually a good thing, because it's also timeliness, right? It's how fast that dissemination of information goes out, and it's vetted rather than just waiting for obviously publication, but getting something that's really actionable in real time. And we saw that during the COVID pandemic to begin with, when things were being brought to us from the national sort of level, and we had people piping up from Los Angeles and New York and saying, here's what we see in real time. And then someone in Kansas saying, we don't see that yet, but we have this problem, and being able to have that unique. And I think that's where it comes down to your point, Clement, where you've got evolving threats or things change. We can sort of pivot much quicker and disseminate that information in this sort of protected learning environment.
I wanted to give Lisa an opportunity to respond. I think I heard her unmute really quickly.
Oh, no worries. That was a great Perry Les. I appreciate that. And I wanted to add to Dr. Chen about the contributions and this not being like a singular workshop, and that we're building this over time. But I also wanted to add that we're building community leaders. And for some of us on this call, I'm sure we know who comes to mind, right? Unlike traditional trainings that end when the session ends and people sign out and they get their CEUs or their CMEs, this Echo has over the last several years built a sustainable community of those community leaders and that practice, because we see session after session people returning either for a refresher or as series leaders. They are creating that trust and that mentorship in the community, and it's really it's creating such an interesting dynamic, because it's not just an audience, it really is all learn, all teach. There are people that regularly attend our series, who we recognize as soon as their hand goes up, they're going to provide us with an excellent in-community resource or an observation about a community that we may not work with as often. So thank you, Chen. Yeah, absolutely.
I think that's a great point of how we're really learning from our participants and really trying to break down those barriers. Jay, I wasn't sure, do you have any examples of how your ECHO program has kind of addressed those barriers specifically, as you'd mentioned during your introduction, since it is kind of difficult to get some of those resources in West Virginia?
Sure. Yeah. I mean, listen, West Virginia is a very small state, but it's very hard to get around. It's all mountains, and it takes about 7 hours to get to one side to another, which is crazy to think about. So access is really troublesome. And so Echo has done a great job of really connecting not only the specialist or whoever the experts are on one end and those primary care organizations, whoever it might be, but it's connecting the other primary care organizations together. Oftentimes they feel siloed, and they are really dealing with the same issues, and they could really learn from each other. So like the other panelists have said, it's creating that learning collaborative, not only between the specialists and the participants, but the participants themselves. And just, one clear example is we have an addiction related echo as well. But one of our participants said, hey, we really need to hear some stuff on suicide prevention. We're having some issues around this topic. Do you think this could be something we could weave kind of into the series? And one of the best things about Echo is that it's flexible. And so we were able to shuffle the schedule around a little bit, get that in there as soon as possible so that information is disseminated in a timely fashion, like others have said. And also just that they feel heard. They feel like they're being supported by the team, by the people in the groups. And so it's just that helps with all that, the equity and the access. They just feel like they're actually being heard, whereas they most of the time feel like they're just out on their own by themselves. So, yes.
Thank you. I think a lot of this kind of equity kind of drives back to the original mission of Project Echo, and really those case-based discussions to really help individual people and providers understand how to treat their patients better. I wasn't sure if anyone on the panel would want to talk about how we do case discussions and really how they lend themselves to great opportunities for learning and discussion.
I'll give a quick example, Sean. I think it was just like a couple of weeks ago. It was sort of a case-based learning all in one. It was a didactic and the case where one of our providers, was talking about how do you really keep patients on buprenorphine and reducing precipitated withdrawal, and how do you manage how do you provide that withdrawal management, right? And then he utilized phenobarbital as a strategy. And then people are thinking like phenobarbital, oh, so very complicated. There's a challenge as far as dosing it. Right. And he shared with us his experiences with the patient and the protocols as well. And it really facilitated that, that two-way street that I mentioned before, that communication to how do you further help enhance his practices so that, hey, we can get more and more people, onto buprenorphine. So this case-based learning is like where we might be the subject matter experts as the hub team, but I like to think of the network as also subject matter experts as well.
Hannah, I'd love to hear what you had to say.
Question, especially after hearing this fascinating sort of like hub approach with what sounds like folks from different disciplines, professions, and roles really sharing their information with each other. And I wonder if at sort of the onset or throughout hub meetings, there is any type of like formal or unspoken culture around like power sharing and how folks who may professionally like be within a position that traditionally holds more power, sort of like yields the floor and shares information bi-directionally with folks who may, one person may be in a prescribing position and another person might be in a non-clinical role in, let's say, a hospital setting or something like that. So I'm just curious sort of like how Project Echo contains that.
I will throw it over to some of our Jay. It looks like
Yeah.
you're ready to go.
That's a great question. That comes up a lot. And oftentimes it's not really finding the expert. We can find people that actually know what's going on and can deliver the information. It's how are they in a group setting? How are they, what is their, are they kind of fit the model where it is that bidirectional communication, but also working with that team that are bringing other disciplines in, like you're saying, Hannah. So like if you have a prescriber, you have a therapist and things like that. And so you have to be able to you want to tailor your team as best you can that they complement each other so you don't have those issues. I mean, it can come up, it's not that it doesn't, but that's what we found over time is that it's often not, we know this stuff, but it's just, can you work in that dynamic to create that safe space, that community of practice where people feel like they're, being heard on one end, but also not overstepping in others. And we do a lot of practice, before we launch projects, Hannah. We do a lot of like mock sessions and things like that where we'll throw kind of those, scenarios at them where it might trip them up to kind of show them how we want to try to handle those situations. And it's okay to say, I have nothing further to add if you're on that team as well. So, yeah, great question.
Thank you so much.
Les, I see you have something to contribute.
Yeah, thanks. I think you're right. Democratizing that information, but really also creating sort of a flattened hierarchy is important. And one of the things when I first joined on the Echo, just as a participant, was kind of feeling that sort of culture of the all teach, all share, and all learn at the same time. And there were certain things I brought to one of the SUD Echoes as a paramedic that works on a street that I don't think were evident or obvious to those on the research side. And so I think the more that you sort of connect the real life to the data that you have in front of you, it removes sort of an echo chamber issue that may develop if you weren't part of an echo like this.
Clement.
Les just mentioned culture, and I think the Echo model really fosters that, that cultural humility. We talk about cultural competence and cultural humility, right? And just being part of the expert panel here, and I think this might answer some of the questions about, how does it help us professionally, right? It emphasizes the continuous learning that we do. It helps us to self-reflect, and it's really the work that we do in Echo is really a commitment to continued learning from other people. And I think that's really what, you foster that cultural humility in just the environment that we talk to with our network, and to the patients themselves.
Lisa, I'm happy you raised your hand because I was going to call on you anyway. So Lisa, please.
Sorry, I was just inspired by Dr. Chen because as you were talking about that, this is Project Echo, but the funny thing about Rutgers Echo is information is not coming. It's not echoed from a doctor talking at people or a specialist talking at people. Like I said, it's that conversation with people. And when I hear the word echo, I think echo chamber, but this is the opposite of an echo chamber. It's the opposite of traditional learning, and like I said, it is creating that space. And like I said, I just thought, like as you were saying, that it was such a funny observation that even though we're called Echo, we don't have an echo chamber here. This is a front line for professionals sharing their experiences and sharing their knowledges equally. And as we're directly connected or indirectly connected to an individual's care. Yeah.
I think that's a great addition. I think it also kind of reflects that all teach, all learn principle that a lot of these echoes are guided by. And with that in mind, even as series leaders, all of you are still learning and getting a lot of great information from the community. So I'd love to hear from each of you kind of how Echo is supporting your own professional development. And maybe I'll kick it off to Les to start that one off.
Sure. I mean, I reflect back to some of the things that we did originally, again, sort of the CDC Project First Line, talking about PPE. And then when the team approached me and we talked about the simulations for the intellectual developmental disability aging adult community, the IDD community, I was like, wow, this is really a patient population that I very infrequently see, but when I do see them, it usually is very complicated. And so it actually sort of made me dig a little bit more into that patient population and learn more about it myself, sort of as a self-learning activity. But then the other part to it is that crafting those simulations, running through the scenarios as part of our hub. Also, I'm using that towards my certified simulation health educator advanced portfolio. So I've put that through, and it's part of my portfolio actually as part of my teaching experiences, and that's being evaluated at the national level for a certification that I'm going for.
That's great. I'd love to hear from Clement on this one as well. Kind of how has Echo kind of supported your own professional development?
I think I mentioned it a little bit with the whole cultural humility piece, but also I think just being a lifelong learner, right? You have to remain humble. As I already mentioned, like just because we may be experts on the panel, that does not mean that our network are not important contributors. So I think of our network as extensions to the work that we are doing, where to just add to the quotes of all teach and all learn. And sometimes, if anything, they often bring much more to the table to really enrich the discussion and sharing tools that we may have not known about. I mentioned that example with phenobarbital, but we also featured a dance educator in one of our sessions before who helped participants explore, movement and creative expression as tools to support emotional regulation and personal connection, which are really two areas that are so crucial to combating and overcoming substance use disorders, and therefore critical for that individual's road to recovery. So it's like this is what it's about. Like, how do you enrich your clinical expertise, which I focus a lot about clinical treatment options, but also the other techniques that are just as important, if not more important, in someone's recovery, when we think about it from the substance use disorder example.
And Lisa, I don't want to cold call on you, but I'd be interested to hear, as someone who started off, in a participant role and is now a series leader on so many different series, how has this really kind of supported your own professional development?
Yeah, sure. And I've learned from most of the folks that are on this call, so thanks for that. Um, I I think I'm a pretty good example of someone who was an attendee, has been a series leader for the last couple of years. I've certainly benefited professionally from all of you. First off, although I sometimes am incorrectly introduced this way, I am not a doctor. I don't have a direct background working in epidemiology or diabetes management. I'm a big fan of lead New Jersey, but I'm not a lead specialist, right? That being said, I think that in addition to the education and the knowledge, I have so much more empathy and respect for people in those roles, especially during COVID and learning about their experiences. And um, I've also learned that Echo helps to balance our diverse voices in meaningful dialogue. Keeping our sessions focused, of course, on whatever the topic is, but sort of the question that came up earlier, each of us can bring our fields of study, our fields of background in such an impactful way to any topic. And it goes to show that anyone who joins Echo, whether you're a learner or a series leader, you can expand your knowledge, you can expand your empathy, emotional intelligence, and you can learn alongside your peers and participants, and doing so, gaining not only um, again, it's great to have the resources and the research and the tools, but just the insight um, to providers and to roles that you're maybe not necessarily in, which I think does also contribute to cultural competence, humility. Um, it's also just, frankly, been beneficial to me professionally. It's connected me to this greater network of professionals across many disciplines. I always mention NJ lead or lead. I always mispronounce that, but that's an example. So if you're a professional and you want to expand your network, attend Rutgers Echo Series, because I've got somebody for phlebotomy, I've got somebody for lead, I know somebody at the state for questions about workforce development. I mean, that is one of the really cool things. That's like, I guess, an unspoken benefit of Rutgers Echo is you're not just learning from these professionals, but I got to learn from and get to know Dr. Clement Chen. Like, that's pretty awesome. What other series allows you to do something like that, right? And I got to work with Sean and learn about your research. And I think that visibility and that credibility from other leaders helps you to grow personally and professionally. So Echo is awesome for systems level change and for professional growth. Yeah.
I think that's great. And we're getting towards the end of the panel. So I encourage the audience, if you have questions, put them in the chat. Feel free to raise your hand and come off mute. We very much like a chatty chat going on while we're talking. But to kind of wrap up our panel discussion, I'd love to hear from everyone about how Echo can really help disseminate not only new information, but also research and different new tools that are developing in each of your fields. So I don't know who would like to kind of start off that discussion.
I can go first.
Right.
Like, sure. Yeah, Echo is great for disseminating results for sure in a timely fashion. It's also been very helpful for recruitment for different projects we do within the CTSI. Just being able to have, share a flyer on the screen or have somebody come in and talk about a research project on a certain session that kind of, makes sense. Just puts a, name with the face and everything like that. You can see them on the screen. It's great. And so it's just a nice way to get them tapped in to the network, to the Echo network. Also, I mean, Echo is a great addition to grant applications because it is not just your typical, what are you going to do? Community stuff, all the typical. We're going to do a forum. We're going to do a survey. We're going to do, the typical run-of-the-mill things. When you can add something as interactive and as dynamic as Echo to your grant applications for research projects, whether it's the dissemination tool. For instance, we do a clinical trials. We're doing clinical trials project in West Virginia. And one of our echoes is to do a community of practice for those sites, those primary care sites that are doing that clinical trial to learn how to best implement it in a rural site. And so it's just that way of, attaching it to a grant application makes it much more appealing than doing some of the traditional things that aren't bad, but just kind of spices it up a little bit. And so it can be a great tool for a lot of different things when it comes to research.
I think that's great. Does anyone else from the panel have any thoughts on that?
I'd add there's certainly a benefit in New Jersey. I mean, and I've mentioned this a few times on prior Echo series, but there are 21 counties in New Jersey, right? So each of the 21 counties, I think on an annual or triannual basis, they publish something called a community health needs assessment, which again, to some folks on here, you already know what that is. Interestingly, that data that's contributed is from healthcare providers, nonprofit organizations, hospitals, FQHCs. But so much of what's covered in these annual or triannual community health needs assessments are the very topics, the very tools and requests for resources that are discussed in these Echo series. So I think as for opportunities for expanding or spreading sort of research or tools, it would be really cool to have the Rutgers series more involved with those community health needs assessments. And I absolutely think that's something that maybe there's an opportunity with Department of Health to do that, to contribute to that data.
I think that's great. Well, thank you so much for our amazing panel. It was really great to hear from everybody and your own experiences as both, participants, series leaders, and Echo employees yourselves. I'm going to hand it back over to Amy just to close out kind of our information for today's presentation.
Awesome. Thank you, everybody that participated in the panel today. I've also learned so much from you all, and I've really appreciated the opportunity to work with you on many different projects. We hope the broader audience today, we gave you a deeper look into how Echo may be able to support your own work, whether you're conducting research, driving health equity, leading innovation in the field. We'd love to continue the conversation and explore how we can collaborate and make a broader impact together. So if you or a colleague or department within Rutgers, outside of Rutgers, are interested in learning more, developing your own series, we're always open to new ideas and opportunities for collaboration. On the next slide is my contact information. We'll drop it in the chat. It'll be in the slide deck that will be circulated after today. So please feel free to reach out, and I'll pass it back to Hannah to close this out for today. Thank you.
Thanks so much. I am just going to find my closing screen if I can get it there. Let's see. Share screen. Okay. Maybe. All right. Okay, so this is really just we have a couple minutes left. If anyone has one last question that they want to raise their hand and ask or throw into the chat, it looks like we have time for one quick one. If not, I'll close us out. Someone just come off mute? No, I don't think so. Okay. So we are coming to the end of our time. So I want to thank you all today. And of course, thank you, Amy, and all of the panel members. We really appreciate you giving this great talk and sharing your expertise with the NJAX community. And I want to wish everyone well and take care. And we will see you at the next seminar.